and once I glide over and then rotating the hook clockwise by 90 degrees or so in an attempt to embed the tip of the hook into the wax and keratin plug, and then I can slowly remove it. Now, although the surface of this plug was hardened, the core of it was actually quite soft. So as I was rotating the hook, instead of extracting the wax and keratin plug, the tip of the hook just dissected through the wax and keratin plug, and instead of removing it, it just cut it up into little pieces, which can sometimes be helpful because I can then go back in with the microsuction tube like I am here to vacuum out some of the loose fragments of the wax. And you may have seen there I was trying to lift the bottom part of this plug off the floor of the ear canal, but it's really embedded. So I've reached out for the forceps as well, and I'm going to try and get the bottom jaw underneath this. You can see I've got a good angle there to work with, and I'm lifting it up, trying to detach it from the floor of the ear canal, but the skin that's attached to the ear canal and the plug is extremely adhesive. It's holding this wax in place. It doesn't want to let go. So now I'm going to enter with the hook. I'm going to go underneath and then rotate it anti-clockwise. I'm trying to get underneath it and scoop it up so I can separate it, which I have. And now I'm going to the back part of the ear canal, and I'm going to rotate it clockwise, trying to bring it through. This ear was slightly narrower near the entrance as well, which made it a bit more difficult. So again, just trying to get the wax plug from underneath and lift it up and away and off the floor, trying to mobilize this wax plug. Quite often when you're performing earwax removal, you're preparing the wax so then you can later remove it. It's not always about trying to remove it immediately. I've realized here we're going to have to loosen it, detach it. So I'm just trying to go all the way around. And now to the back part of the ear canal. And I'm trying to bring this wax and keratin into the center. By bringing it into the center, we're bringing it away from the side ear wall canals. And now I've reached out for the Jobson horn. I'm just going to go over and behind and trying to leverage this out. As I'm bringing out the Jobson horn, I have to accommodate for the curvature of the patient's ear canal. Otherwise, the Jobson horn will just make contact with the ear canal wall. So our ear canals are not straight cylindrical tubes. They have bends and twists, widenings and narrowings. And when you're in the patient's ear, you get a better perspective of their anatomy. So every time I'm bringing this Jobson horn out, I'm maneuvering it around the bends and twists and accommodating for the widenings and narrowings in this patient's ear canal. So I think I've managed to remove the lateral plug of wax and keratin. So anything beyond the second bend, which is where we are now, the canal to the right there, that's the second bend of the ear canal. And where you find the second bend of the ear canal is where the cartilage portion of the ear canal meets the bony part of the ear canal. We call that the osseo-cartilaginous junction. So when you're working around the second bend, you know you're not too far from the bony part of the ear canal. And as I discussed earlier, the skin that lines the bony part of the ear canal is extremely thin. It's less than 0.1 millimeters in thickness, so we do have to be very careful and gentle when we're working on the bony part of the ear canal, because if you do make